This is, of course, Understanding CBD with Max and Steven. This is our segment where we finally get to talk about the sponsor of this show, which is Max and Steven's Premium Hemp Extracts. That's That's Steven and I. And this is our opportunity to talk about some stories and conversations that we've had related to our product specifically, right?
Yes.
So a call that I had this week was a lovely lady who we met at the Pikesville Farmers Market, and obviously it's been cold, so we haven't had the Pikesville Farmers Market, but this was a customer that purchased product from us, and she decided to call me, and she wanted to, first of all, reorder and wanted to know if we'd honor the discount, and of course we would. But more importantly, she said that, she's been having good results with it. Her husband even started using it, but she had some questions around drug interactions. And so our standard conversation around that topic is that you should speak to your medical professional, most certainly. And that's what I told her. But, we did a little bit more digging, right, Stephen? Actually, you did more digging. To give full credit where it's due. And so would you like to enlighten us on that?
I would. And I want to be clear, too. A lot of times people ask us questions about how will CBD interact with a specific pharmacy, a pharmaceutical product that I'm taking. And that's not what I want to talk about today. I want to talk in general of what sort of interactions of drug interactions. Could be caffeine, sugar, nicotine, alcohol. What sort of aspirin? What sort of interactions are there? And without going into specifics, there's really 3 different primary effects that drug interactions can have inside the body. I want to outline them here. So if you have something to write with, this could be helpful too. The first of the 3 is an additive effect. And an additive effect, easily explained, is 1 + 1 = 2. So if you have CBD plus something else, they just are, the same as they would be separate, just together, right? So it's just adding on to each other, just line up together. 1 + 1 = 2.
1 + 1 = 2.
It'll make more as I go to the second one. The second one is a synergistic relationship or a synergistic effect. And that equation looks like 1 + 1 is greater than 2. Now, that means the combination of CBD and whatever other thing you're taking or using is going to be greater than the 2 separately. So there's some sort of synergistic relationship where they enhance each other and have that synergy to multiply their effects, right?
Similar to your relationship currently.
That's right.
Synergistic effect.
Synergistic. The third one I wanted to hit on is an antagonist relationship, which is, as you can imagine, would be different. So that sounds like 1 + 1 is less than 2. So this is the one that most people, I think, are concerned about, which is, hey, if I use, I take CBD and it's not working. We hear that often. Okay, well, let me ask you a few questions. Well, I know we had a caller not long ago. She says, well, I do drink a couple, Coke Heavies a day. That's the full sugar and full caffeine.
Smoke a full pack of cigarettes.
I smoke some cigarettes, and I really don't watch my diet much. Why isn't CBD
But
helping
will CBD
me?
fix all that for me?
Right.
Basically, right?
Yeah, exactly. I'm watching TV up until until the middle of the night. I turn it off, and I don't exercise. And why isn't it helping me do these things? So we want to set that at least expectation and understanding for everyone that there are synergistic, antagonistic, and just additive relationships that can happen in the effects of CBD in your body, and be aware of them. So you really have to take a look at the holistic person. And just because CBD can do magical things with people, if your body, and say everybody's different, if your body isn't ready for this, if you're doing some things that aren't in line with the benefits of CBD, if there's an inflammatory, if you're trying to fight inflammation and you're eating a lot of inflammatory foods and taking CBD, you may not notice what CBD is doing because you still have inflammation.
And it's also important to set very realistic expectations. I mean, 2 things that we say all the time is set very realistic expectations of what you can expect in a reasonable time frame. And the second thing is be absolutely consistent with using the product. And this note goes out specifically to my wonderful mother-in-law, and I just had this conversation. Be consistent with the product, and you'll see that you'll have amazing results. Potentially.
Yes. Speaking of that, I'm going to take my CBD right now.
Steven's taking his CBD right now.
Yeah.
Okay, so great. So that brings us to another conversation that we actually had this week, and this was a customer that called in, and I believe it was a state issue. So we want to talk about some state restrictions.
Yeah. So a friend, a customer of ours in Maryland has someone in, I think it was in Idaho. And she tried to order on the website, and she's like, it's not working. Can you help me? So she called, and I'm trying to put the order in. And then I realized that we are prohibited from sending CBD to a few states. I want to outline for you. There's Idaho, Iowa, and Nebraska. Idaho, Iowa, Nebraska, and North Dakota.
North Dakota, right.
We are not allowed to send CBD there for one reason or another. I think and she had no idea.
Right.
Like she was like, what the heck's going on? I told her to call our congressperson and get this thing straightened out.
And let's be clear about that. So hemp-derived CBD is federally legal right now, which means there is no problem federally, but it's still state dependent. So there are certain states that still have restrictions. We try to update our database as often as we are informed, so we'll try to do our best about that. But if you try to order from our site from any of those states, for whatever reason, at least now you know why, please send us a note and we'll see what we can discuss.